Many people claim to have phobias. Even though some are exaggerating, according to the National Institute of Mental Health, an estimated 9.1% of US adults had a specific phobia in the past year. Phobias are characterized by an excessive and persistent fear, sometimes even irrational, about a specific object or situation, and some phobias are more common than others, but they can all be treated. Now, everyone in the world today suffers from some kind of fear. However, some people experience a more severe form of fear, which is known as phobia. I myself have a phobia, and I done my research, and I know what phobias are and how they can affect our lives. And chances are that you're also afraid of something, even though it may not be as severe. Learning about what phobias are and the many different kinds of phobias will hopefully provide you with a better perspective of what fear can really look like and how it can be treated. Now, first, we need to define fear. We need to know what fear, what we need to define phobias. We need to know what phobias really are. And according to Harvard Medical School, a phobia is a persistent, excessive, unrealistic fear of an object or situation. Now, a person with a phobia either tries to avoid the thing that triggers the fear or endures it with great anxiety and distress. Now, it is normal to fear something, but people with phobias have an overwhelming and unreasonable amount of fear to something that possesses little to no danger and still causes extreme anxiety. Now, causes of phobias, the main cause for phobia is trauma and vicarious learning. And as we can see in the example here, we have astrophobia, which is the fear of thunder and lightning. He is afraid because of trauma that he had in childhood. Now, phobias can limit your daily activities. They really affect our daily lives. Besides the severe anxiety, people with phobias often avoid coming into contact or situations with the thing that causes them fear and anxiety. As we can see in this example, they will check the radar and the weather every day just to avoid going into a bad weather that can have lightning. That means that he will not go to work because there's going to be some lightning, and that's how bad it affects our daily activities. Now, we also need to consider what kind of phobia we are dealing with, and most phobias can be categorized into groups. There are three main types of, or categories of phobias. The first category is a specific phobia, which is also known as simple phobias, and the other two categories are social phobia and agoraphobia, and these two are known as complex phobias. Now, specific phobias or simple phobias are usually fears about something such as situations, living creatures, and other things. And the example that we have here is a specific phobia. He's afraid of lightning. And we also have like another example would be arachnophobia, which is the fear of spiders. Now, the second category is social phobia, which is also known as social anxiety disorder. People with social anxiety fear social situations. They'll avoid crowded places, and sometimes they will even not answer a simple phone call because they're afraid of being embarrassed or judged by others. And the last type is agoraphobia, which is the fear of being in public places where it would be difficult or embarrassing to make a sudden exit. A person with agoraphobia may avoid going to a concert or travel through a train on a train because it's difficult to escape or make a sudden exit, and it may be embarrassing to do so. Now, although it's difficult to face your fears and cope with them, there are ways to overcome them. There are options for treatment ranging from medication to therapy, and the two most common types of medications are beta blockers and antidepressants. When we get anxious, our adrenaline levels rise and cause panic, and beta blockers block the stimulating effect on the adrenaline on our body, and antidepressants work as a mood stabilizer so that the patients don't fall into anxiety symptoms. Other types of help is psychotherapy, which the client learns the causes of the fears and tries to overcome them through different techniques and various observations from the therapist. The most common ones are exposure and behavior therapy, which are treatment options for the example that we have here. Now, exposure therapy is just what it sounds like. A therapist seeks to treat the client's fear by presenting them with the object that causes their problem, with the idea that they will eventually get used to it. And in behavior therapy, the client learns to cope with the fear through alternative perspectives. And the example that we have here, it would be seeing lightning as something good, because if we have lightning, we have rain, and if we have rain, we have plants and we have flowers. So that's nice. It's just learning to see it through different perspectives. Okay. So we've learned that phobias are severe fears, something specific, and we also learned the types of phobias and what treatment options can look like, ranging from medicine to therapy. You know the characteristics and the types of phobias, and even though it's difficult to learn to face your phobias, if you seek professional help, there are ways that they can help you overcome them. If you or someone you know is being affected by phobias, I hope this newfound knowledge will help you and others face your fears in the near future. Thank you.